अरबाज भाई सामने
सर सामने सर
अरबाज भाई एक ग्रुप फोटो
सर ग्रुप हो रहा है
अरे ग्रुप की so everybody towards the right
सर यहाँ पे सर
thank you
Ladies and gentlemen, a big round of applause for the launch of our event. Plus doctors, 2,300 plus diagnostic centers and 6,000 plus pharmacies. We've served millions and millions of patients and moving towards our vision of touching 1 billion lives. At the core of Apollo's patient-centric culture is the good old and very effective TLC, Tender Loving Care. About Apollo Health and Lifestyle. Apollo Health and Lifestyle Limited, AHLL, is a subsidiary of Apollo Hospitals Enterprise Limited, AHEL, is one of the largest players in the retail healthcare segment in India. It functions primarily through its 8 core offerings, Apollo Spectra, Apollo Cradle and Children's Hospital, Apollo Fertility and Primary Healthcare models like Apollo Clinic, Apollo Sugar Clinics, Apollo Dental, Apollo Diagnostics, and Apollo Dialysis Clinics. About Apollo Spectra hospitals, in India, the healthcare industry is undergoing a revolutionary change, mainly due to the rising income levels, increasing awareness of lifestyle diseases, changing attitudes of patients with the growing demand of planned elective surgeries in India. Apollo Spectra plays a key role as specialized ambulatory surgical centers, ASC, offering several advantages like specialized focus, lower risk of infections, faster turnaround and efficiency, cost efficiency, and patient convenience. The beauty and boutique quality of the format of Spectra is to provide the advantage of expert and quality healthcare with all the benefits of a large hospital, but in a friendlier and more accessible facility. Since our inception in 2015, we have grown to a robust network of 24 hospitals in cities like Bengaluru, Chennai, Chirala, Delhi, Gurugram, Gwalior, Hyderabad, Jaipur, Kanpur, Mumbai, Mohali, Noida, Patna, Pune, and Rewa, among others. Apollo Spectra Hospitals has always been guided by a patient-centric approach. Patient care and safety have always been at the heart of what we do. Our objective is to ensure that our patients get access to comprehensive, affordable, and personalized quality healthcare. As a constellation of hospitals, Apollo Spectra Hospital boasts over 5 lakh successful surgeries with outstanding clinical outcomes, all under the care of 3,000 plus leading doctors across a wide spectrum of specialties. Our state-of-the-art facility harmonizes advanced technology with world-class infrastructure, ensuring faster recovery with near zero infection risk. Our commitment to hassle-free patient experience is reflected in our easy and streamlined admission and discharge processes. About robotic surgery launch, which is why we are all here today. Joint problems are increasing among people across the country due to sedentary lifestyles, lack of physical activity, obesity, age, knee arthritis, and injuries. Osteoarthritis is the most common joint disease in India, with a prevalence of 22 to 39%. With a constant focus to provide superior clinical results for people who need knee replacement due to age-related issues, arthritis, obesity, and injuries, the Apollo Apollo Group has always been at the forefront of bringing all these medical innovations in India. Patients seeking knee replacement surgery can now benefit from the expertise of Apollo Spectra's skilled orthopedic surgeons combined with the precision and efficiency offered by the Rosa robotic system. All right, it's my joy to now invite on stage Ms. Rupinder Kaur, the COO of Apollo Spectra Hospitals and Head Secondary Care, to give us a small talk about this launch today. Ma'am, would you want this?
Namaste all, good afternoon. It's a pleasure to be here amongst all of you as we celebrate this very remarkable milestone in the advancement of orthopedic care in Apollo Spectra. First of all, I would like to extend heartfelt gratitude to our chief guest, Mr. Arbaaz Khan, our clinical champions, Dr. Alok, Dr. Nadvi, doctors here present from the medical fraternity, and our friends from media. Welcome one and all. So today is not just about the launch of a new technology. It's much more for us. It is about how we want to revolutionize the care that we provide at Apollo Spectra by ushering the future of orthopedic surgery with robotics. Apollo has been doing it consistently over the last couple of years. We have had many firsts. We have been there at the forefront since last 41 years. And in fact, I think when our chairman and founder, Dr. Pratap C. Reddy, laid the very first brick for the hospital in Chennai, that itself was a milestone in itself. It was about doing things in a new way, delivering healthcare in a new way in the country. So over the last couple of years, we all know Apollo has been associated with providing high-end, complex tertiary and quaternary care. Yes, we treat advanced cancers. We do bypass surgeries. We do neurological surgeries. But our joint managing director, Dr. Sangeeta Reddy, who actually has been sort of a torchbearer for Apollo Spectra, also know that a lot of care that is needed on ground is also about simple day-to-day problems. And for simple surgeries and simple procedures, maybe patients don't want to navigate through a very complex tertiary and a quaternary care environment, and from that the concept of Apollo Spectra was born. So it's been about a decade now, and the idea was that how do we integrate high technology into an environment which is very accessible, easy, friendly, less scary, but still keep the quality and the safety standards intact. So I'm very proud to tell you, and I think it was mentioned a couple of minutes ago, that today we stand 22 plus centers strong. We are there in 17 cities across India. We have done 5 lakh plus surgeries and procedures while maintaining the quality and the safety standards. And in fact, if you look at the data which is available industry-wide, almost 50 to 60% of the surgeries or the small procedures can be done in formats like Spectra, which again are much more friendlier and easy to navigate. The system is much easy to navigate. And one of the key USP that we have seen of Apollo Spectra over the years is that doctors love operating here. In fact, I'm speaking on behalf of Dr. Nadvi and Dr. Alok. I hope you will resonate with that. But our doctors really enjoy working with Apollo Spectra. So we have been watching this robotic space over the last couple of years. It's been evolving, and now when it has kind of reached a critical mass, where we think the robot can actually do multiple things and is adding real value, is when we jumped in. We are quite bullish about this space. I think the patients are going to demand it more and more as we move forward. The surgeons are loving it because it's provide them the tools to make the surgery much more precise and customized according to the patient. So Dr. Nadvi and Dr. Alok probably will be talking a little bit more about it from a clinical context point of view. But more important thing is that we are in this for the long run. We want to do replacements which will be there for a long period of time, which will not require redos. And one of the main reasons, again, our clinical champions Probably we'll talk more about that. But one of the main reasons why the redos are required is because there is a problem with the surgery has not been done exactly right. So as we move forward, we think if a patient knows that this technology is available, then they are definitely going to want to opt for it. So what we are presenting here today to you is what the technology can deliver in an environment which is much more friendlier, easy to navigate, and again still maintaining the same quality and the safety standards. In this format, we intend that we are going to continue to expand very rapidly in new markets. We are going to continue to invest in infrastructure. We are going to continue to invest in technology and continue to strive healthcare of best standards to the communities at large in the country. And last but not the least, I want to thank my team here on ground who really did great work. Ashfaq, Dinesh, Abdul, Nishant, Dr. Vijay Agarwal. So thank you for all the support. Thank you everyone for all your blessings who are here today with us. And last but not the least, the doctors who have really carried with us in this journey together. I think we have many more milestones to achieve together at Apollo Spectra. Thank you again once again. Thank you.
Thank you for your talk, ma'am. If you will just stay back for a few seconds, I'd request you to kindly felicitate our chief guest, Mr. Arbaaz Khan. Ladies and gentlemen, Mr. Arbaaz Khan needs no introduction, but it's my job to give it anyway. Mr. Arbaaz Khan is an established actor in Bollywood for many years now, and also a very, very strong producer. Since his debut in '96, he's acted in many leading and supporting roles, ventured into film production, with Dabang in 2010, in which he starred as the younger brother of his real-life brother Salman Khan. Both of you make a fantastic duo. The film went on to become one of the highest-grossing Bollywood films of all time, and he's won the National Award for Best Popular Film, providing wholesome entertainment for the film. We are all, ladies and gentlemen, very happy to have him get some time out for something very important for us. So, will be lovely if, ma'am, you can honor him with a small bouquet, token of our appreciation for being here this morning. May I please invite Dr. Vijay Agarwal to also do the honor for all the other important invitees today. Mr. Pandar, if we can felicitate you now. Dr. Vijay, if you will please do the honors of giving a small token of our appreciation to her. Yes. Look here. Dr. Vijay, if you will please continue to give us just a couple of more minutes to felicitate Mr. Rajkumar Seksaria, the famous studio owner. I believe you are here, sir. Yes, please. Good morning. Welcome. Namaskar. Again, please take place. The very, very famous studio ke very, very famous owner, Mr. Rajkumar Seksaria. Good morning, sir. Welcome. Thank you, sir. Thank you for being here. Good morning. Dr. Safiuddin Nadvi, consultant orthopedic. Maybe please do a small honor for you, sir. Dr. Safiuddin Nadvi. Dr. Safiuddin Nadvi is a distinguished orthopedic surgeon with over 21 years of experience in orthopedic and joint replacement surgeries. He specializes in ortho, trauma and reconstruction, focusing on knee and hip arthroplasty as well as ACL, PCL reconstruction. Dr. Alok Pandey now.
ओ दादा wait, wait.
Dr. Alok Pandey is a consultant, joint replacement and orthopedic surgeon with over 15 years of experience. He has successfully performed more than 1,000 joint replacement surgeries, excelling in complex primary and revision hip and knee replacements. Can we now have Mr. Nishant Mishra, CMO, the Chief Marketing Officer, Apollo Health and Lifestyle Group.
अच्छा
May we please now have Mr. Ashfaq Sheikh. Mr. Ashfaq Musa Sheikh, Zonal Business Head, Apollo Spectra Hospitals, Mumbai. Will you please join us? Actually, we have the honor of having the Consulate of Oman, Badr Bahebi, with us. May we please have you on the stage for a second, please?
They are supposed to be there in 5-10 minutes.
5-10 minutes.
All right, may we please have Madhumati Lele, the CCI president here. All right, I believe we can have that done a little later. May I please request Mr. Nishant Mishra to now do the honors and have Dr. Vijay Agarwal felicitated. All right, thank you, ladies and gentlemen, for your kind patience. May I now please invite Mr. Arbaaz Khan to kindly give us a little talk about what do you think about our launch event, sir, this evening, this afternoon. Will you please run this?
Hello. Good afternoon, ladies and gentlemen, respected dignitaries on the dais, distinguished guests, doctors, and my friends from the media. It's an absolute pleasure to be here today, being a part of this healthcare event. Thank you, Ms. Kaur, Dr. Vijay, Dr. Alok, Dr. Saifuddin, and the entire Apollo team, and the management for giving me the honor to be here today. The field of healthcare is deeply connected to society, and being a health and fitness enthusiast at personal level, I'm really thrilled to be among such a gathering. I'm sure whenever we think of healthcare or hospitals, one name that always pops up in our mind is none other than Apollo. And that's the leadership status and legacy Apollo has achieved today, with the decades of hard work, patient service, and commitment. Today, India is one of the front runners when it comes to quality healthcare, and our doctors are second to none. The whole world looks up to India for quality and cost-effective medical treatment. All this started with the vision of Dr. Pratap Reddy 40 years back. I'm sure Apollo will continue to lead the way, bringing many more innovations and shaping the future of healthcare in India and beyond. When we talk about innovation, I believe technology plays a very important role. AI is transforming healthcare system by enhancing treatment outcomes and improving overall patient experience. Technology has changed the way we live, and even healthcare is not untouched by it. If you are likely to develop a heart problem or maybe osteoarthritis in the next 10 years, you can get to know it today through some tests thanks to Apollo Pro Health. Imagine how easy, safe, and simplified our lives have become thanks to such advancement made by Apollo. Then in case of surgeries, I remember back in the day when an injury to the bone or joints, especially in sports or cricket, would bring a long and painful recovery, you would now have to undergo you would have to undergo open surgery. It would take months before you could fully recover and return to the game. But now things have changed so much. The technology is advancing so rapidly. Although robotic surgery has been around for a while, I've heard so much about the benefits: high accuracy, minimal scars, and extreme fast recovery. But what makes this even more special today is the fact that Apollo Spectra is offering this advanced technology in a daycare, boutique-style, multi-specialty hospital setting. I believe this is the first, and it is a fantastic news for the people of Mumbai. It means quicker recoveries and fewer disruptions to people's daily lives, which is what we exactly want. Spectra is a pioneer in daycare and short-stay surgeries, offering cutting-edge technology that helps patients recover faster. They have truly revolutionized the way people approach medical procedures, and it's no surprise that they are the best and fastest growing chain of hospitals in this niche area. As we witness the launch of this robotic knee replacement system today, I am truly excited to be here in the company of so many esteemed doctors to witness the milestone in the field of orthopedic surgery. It's a revolutionary step forward, not just for Apollo Spectra, but the healthcare industry as a whole. Thank you, doctors, who are doing an incredible job of bringing the highest level of comfort and care to the patients. For all that, I applaud you. It's been an honor to be here. Thank you very much. Thank you, and all the very best.
साथ वाले को बोलो। अरे तो रास्ता चाहिए ना मैडम, विदाउट रास्ता कैसे जाएगा आदमी?
If you will now be
नहीं तो रास्ते में आप लग दोगे कैमरा तो साथ में कौन है?
row of guests and you will allow us a few questions. Ideally, I want to ask what exercise you do, but
Important thing is to be active in some form of exercise if possible. Sedentary lifestyle is probably the worst thing that you can do to your health. It's even worse. It's even worse than smoking or drinking or any abusive habit that you have. Because when you exercise, I think that's the time when, whether it's, flushing out toxins from the body or building muscle, because we now know that muscle is a longevity kind of organ, it's like it helps you live longer, because as you grow older, you need your muscles to get up, to do activity. So when you exercise, you're also helping your joint health and all of that. So any form of exercise, whether it is swimming, running, basketball, weight training, aerobics, or any kind of those, yoga for that matter, are very, very essential and important for mental and physical benefits,
Right, and you mentioned something really important, which is joint health.
Yeah.
So how do you prevent joint injuries, especially if you are
Basically,
regularly
to say it's one has to be mindful about what kind of postures that you are in, even while you're exercising.
Correct.
Okay, so those are important. Warm up before any kind of an activity is important, because some people who are doing weight training sometimes just hit the gym and they just get into a kind of a workout which probably they're not yet prepared, because I think the body still needs like maybe a 5-minute kind of stretching or something.
Correct.
Stretching is a very important thing. Stretching is also something that is very essential. So these are the few things, if you do, they will really keep away from, let's just say, a person who exercises and has a fall, and a person who doesn't exercise and have a fall. If you have muscles around you, you can protect your bones.
Right.
People who are stronger, if you like, let's just say the kind of acrobatic stuff that, say, a WWF guy does. He gets thrown and flung around and all of that happens. Why doesn't he get hurt?
Springs back up in a microsecond.
Why doesn't he get hurt as much as a normal guy? If he had just probably twisted his foot, what would happen to him? Is because you don't have the muscles to protect your bones, right? So I feel that muscles take away a lot of the injury shock.
Yeah.
So the first
and
most
both
important...
the doctors are agreeing completely with what you're saying.
The first most important thing that you need to do is to build muscle, because that's your protective gear towards any injury that happens.
Right.
People who have muscles will survive far greater injuries than people who don't have muscle.
Great, fantastic. So all this medical information that you, I'm assuming...
When I was very young, I was around 14, I met with a very serious Jeep accident, and I was flung from an open Jeep and I landed on my leg and I broke my femur.
At 15?
Yeah, I was about 14, 15 years old, and I had a horrible injury. Fortunately, I mean to say, it could have been even worse, because I landed on my leg, I could have landed on my head, whatever. and I had a mangled leg right in front of me, which had swollen to some God knows what size. So the accident happened at about 11:30 in the morning, but my first attendance that I got to the doctor was about 4:30 in the evening, because first we had to go to my family doctor, then he suggested what needs to be done. So I was in a taxi till then, and my first medical attention happened at about 4:30, and then the doctors, because I was young at that time, had decided
must have recovered better.
whether they decide that I should be put, my leg had to be, the bones had to be screwed or to be put on traction. So I think that time it was Harkishan Das Hospital and it was Dr. Bansal, if I could recollect. He was the one who kind of attended to me, and he probably took some time to say whether they should do those screws on my leg or to this.
Did you have screws in your leg?
No. So he took the decision for me to have traction. But it so happened is that when I healed, sometimes the bones don't join accurately.
Yes.
So I had a limp for almost a year and a half, because my leg had probably been a little shorter than, because of the injury, the joining. So I had, so when the reason why I'm also very, very happy to be here because of the orthopedic situations or injuries to the bones is because I've undergone that scenario.
Yes.
And it had happened at an age where, children play sports. So I used to play squash, and it was a high impact sport at that point in time. And because I broke my femur, I could not play those high impact sports for about a year, 2 years. And then it was never the same. So I could never recover to the what a normal fitness. I did everything. I played all the sports. I played squash again. I swam again. I played cricket, whatever. But I always knew that my left leg was never the same, because it's the strongest bone in the body, right?
Did you wish for some robotic surgery?
Like I said, had that situation, that's what I'm saying, maybe had that situation happened, maybe my recovery would have been faster, maybe my healing would have been as near normal as it should be.
Right.
So technology has come a long way, and I think people of today are actually luckier and blessed that that this situation is there, and I applaud all the people who indulge in this kind of technology, that I wish them all the best, and doctors who perform these.
Doctors are sounding as excited as teenagers using this robotic surgery. It's lovely to see.
But I'm sure robotic surgery, but it's all assisted by them.
Of course.
It's all done by them. The robots are doing what they're being instructed to do.
Yeah, absolutely. Yes, absolutely.
Thank God.
But that's a lovely sharing. That's so lovely of you to share something so personal, but it's absolutely appropriate for today's launch event. How do you see the role of technology?
I think technology is something that is growing ever since.
Yeah.
Like, it's in every field of our life, we are using technology for anything for that matter. So I guess
AI, robotics, it's all very exciting.
Now how much of it is going to be misused, because like everything is like a knife is used for cutting fruits, and also it can do some harm the other way.
Correct,
so everything is, whether the internet or any kind of social media for that matter,
Right.
it's used, if it's used in the right way,
Then it's very advantageous. It's a good thing.
Similarly, if AI is used for detecting illnesses, maybe weeks, months, years in advance, which is
Such a blessing.
It's very good that you're more probable that you're going to get this kind of a disease or this kind of something happen to you, and if you could come to that conclusion, it's very good that you could prevent so many of those illnesses or situations which probably would
prevent disaster.
Yeah.
Right.
Yeah, last minute, which
Fantastic, lovely. So lastly, about Apollo, I have some weird stories from my childhood. I used to wear an Apollo bandage just to look fancy, because Apollo was a fancy hospital. Any stories you have? Apollo is today a leading name.
Yeah, so we always heard of this hospital because some of the very prominent people used to be admitted.
Exactly,
so
yeah.
It's like any kind of dignitary or any kind of statesman
Apollo was the name,
probably
trusted
had
name, yes.
severe heart attack or needed a very, very serious surgery. I mean, it's the only hospital that we used to hear about where they used to go, or they used to want to go, was Apollo. So that's something that they've earned since ever, so that's a great name,
Yes, that's right. All right. So I hope you and your family never get to need to use a hospital.
If that is the case, then probably Apollo is the place.
Right. Thank you for your time. Lovely conversing with you. All right, I believe the consulate from Oman, sir, you are here. Can we please felicitate you?
You're so right.
Mr. Badar Wahebi. May I please invite Mr. Ashfaq Sheikh to felicitate Mr. Badar Wahebi, the consulate of Oman. Mr. Sheikh, if you will just do the honors, please. Good morning and thank you for being here this morning, sir. Lovely to have you here as one of our esteemed guests. I believe you have a few words to say to us, sir. If you will say a few words to us, will you? No? No? All right. Your presence is great. Thank you for being here. Have a great participation of the event. All right. Thank you. May I please now invite Dr. Safiuddin Nadwi to come and speak to us. I believe you have a small presentation. Dr. Safiuddin Nadwi is a distinguished orthopedic surgeon with over 21 years of experience in orthopedic and joint replacement surgeries. He specializes in ortho trauma and reconstruction, focusing on knee and hip arthroplasty as well as ACL, PCL. Please, ladies and gentlemen, if you will join me in giving a round of applause to them.
And Mr. Kiran Shinde, who always keeps pushing me for getting anything new, whatever we want at Apollo Spectra. So I'll be just showing a small presentation on the robotic. As my friend Mr. Saifuddin has covered everything, so very little is left for me to show, but just few slides I'll show that why robotic. As we all know, if someone has to travel from here to Thane, so everyone knows the road and everything, but still the Google map has come into picture. So robotic is something like that only. So robotic is in picture because around 20% of the patients who were operated post traditional knee replacement surgery were not happy. So the unhappy patient ratio was around 20%, and to give relief to these 20% of the patient, the robotic has come into the picture. So what exactly the robot does, it makes a 3D model of the knee inside the operation theatre. The inputs are given to the robot by the surgeon only. The alignment axis, which the human naked eyes can't see, which in scientific term we call it as mechanical alignment, is shown by the robot to the surgeon. Very minimal bone is cut post robotic surgery, and hence the relief, the post-op pain relief is much better, because the amount of bone which is cut in traditional surgery is much more than the amount of bone which is getting cut in the robotic surgery.
एक 20% लोग पेशेंट जो कभी सर्जरी से ना खुश होते हैं, ये रोबोटिक सर्जरी जो इतना एडवांस्ड है, जो उसकी प्रॉपर मैपिंग करती है, जो एक्यूरेसी के साथ वो हेल्प करती है, असिस्टेड बाय द डॉक्टर्स, उसमें वो गुंजाइश जो है वो कम हो जाती है. Advancement is happening in every field, and so is happening in the medical field. And this is a very welcome introduction into the medical field. The robots are going to make surgeries a little more easy, and recovery will be faster, precision will be much better. इसका ये बहुत बड़ा advantage है.
लाइट बंद हो रही फॉर्म करो ना.
Arbaaz has already told that the most important reason is that we don't exercise. We have very sedentary life. We gain weight. We use unwanted food. We are not having balanced diet. So that is the reason why we are having arthritis in our age. Even we have seen arthritis getting bad at the age of 90 days, 30, even less than that.
अच्छा जिस तरह से टेक्नोलॉजी बढ़ रही है बहुत कम लोग होंगे जैसे अराउंड कॉन्फिडेंस नहीं होगी ना तो लोग बाहर होता है और इस टेक्नोलॉजी को यूज करेंगे वो कैसे आप वहाँ तक कैसे पहुँचेंगे.
We are trying to reach out. We are having a special plan, and the Spectra is there to help those people. because as my CEO, Mr. Pendakur, has already said that we have this change because when we go to the tertiary hospital, definitely the things are in the higher end. So we are giving everything which the normal people can afford for that. We are trying to accommodate the people in our hospital.
क्या इंस्पायर करता है ऐसे इवेंट्स पे पार्टी होने
ये डेफिनेटली एक सोशल अवेयरनेस से मान सकते हैं हमारे नॉर्मल जो हम इवेंट्स डिफरेंट फ्रॉम these are very cause or oriented events which we as people from the society should also kind of encourage, because this is something that we need to embrace in terms of the technology and all that stuff. So Oro Hospital has been doing such great work for a very long period of time, having some of the best doctors taking care of people, and whenever they come up with some new technology or whenever they come up with advanced methods of operating, I think it's good to bring awareness in that sense. इस वजह से कभी भी ऐसे अपॉर्चुनिटीज मिलते हैं कि ऐसे इवेंट्स में अपने आप को पार्टिसिपेट करना या कोई अवेयरनेस लाना, तो somebody like me is always very
सोशल मीडिया बाहर सब लोग इंजीनियर की बात की जब हम 14 साल के थे जो इंजीनियरिंग हुई तब उस टाइम से खेलते हैं। आज के टाइम में हम एक बोला पकड़े अपने सोशल मीडिया अपने इंस्टाग्राम तो ये सारी चीजों पे कैसे निकलेगा और पेरेंट्स भी अब इस पर कुछ रिएक्ट नहीं कर रहे।
I guess the parents have to play a very important role in that. अभी बच्चे जब तक बच्चे आपके कंट्रोल में हैं तब आपको एक होता है कि time that you allot them for being on social media and all that, everything has to be, बच्चे you cannot completely deprive them. ये तो fact है कि आज बच्चों को लैपटॉप, आईपैड, फोन से आप बिल्कुल नहीं रख सकते, उनका सिर्फ आप टाइम मिनिमाइज कर सकते हैं, क्योंकि कुछ चीजें ऐसी हैं कि वो आप एकदम डिप्राइव करोगे तो वो पीछे भी रह जाते हैं। आज you learn from the internet and all that stuff, and you don't want your child to be totally lagging behind, but you should minimize the time for everything. There is a small time that's around it. जिसमें sports important है, reading important है, social media पे के ऊपर भी participate करना important है। I guess वो सिर्फ क्या होता है कि टाइमिंग का आगे पीछे हो जाता है। लोग children are spending far more time in their and they're on social media and on schools, that they are on playgrounds or in being active in any sport. ऐसे कि मैंने कहा कि आज सबसे ज्यादा जो बड़ी बीमारी जो है ना वो sedentary lifestyle. There is not a single disease or a problem that doesn't come from sedentary lifestyle. You could be you could be a vegan, you could be a vegetarian, you could not be drinking, you could not be smoking, but if you sit on a chair all day, you have more problems than people who bring any of these because they exercise and whatever. So it's being active is the first most important thing. जब भी आपको थोड़ी सी एक्टिविटी करनी चाहिए, वो आपको कौन सी चीजों से बचाएगा, तो बच्चों को सबसे पहले बहुत इम्पोर्टेंट होता है समझाना।
So about any quick suggestion to the youth?
Like I said, first and foremost, get involved in any kind of physical activity. And along with physical activity, I think today what is really needed is improving your mental health. Because we are being affected a lot by so much of, things around us. Then today, every news is coming to us. Good, bad, ugly, and all. And from Instagram, newspaper पढ़ते हैं, TV देखते हैं, तो constantly हमारा जो दिमाग है ना, constantly उससे नेगेटिविटी से, बट बहुत सी चीजें जो पहले हमको इतनी नहीं आती थी खबर सुनने के लिए, हमको बार-बार we getting kind of bombarded with that kind of scenario, and it has an impact. So how to desensitize yourself from it, how to get numb to it is also important. Let's just say that they are orthopedic surgeons, right? अभी इनके पास किस किस्म के केसेस आते हैं? इंजरी टू एन एक्सटेंट, कोई गाड़ी का एक्सीडेंट हो गया, कोई गिर गया, सीट से गिर गया, कुछ हो गया। अब ये अगर डर जाएंगे कोई, अरे ये क्या हो गया, तो ये ऑपरेट नहीं कर पाएंगे। So they have to be in a very good state of mind. Similarly, I mean to say, all what is happening around us, we also get affected by it. How? एक तो है कि हमको sensitive तो होना ही है दुनिया में जो हो रहा है, but at the same time, how we can still keep our mind cool and not overreact to things and how any kind of counteract. So mental health along with physical, it's a combination. तो दोनों चीजें, so whether it's yoga, meditation, things that you read, learn. What's the video? That was something.
Thank you, Arbaaz.
Thank
Thank
you.
you,
Thank you
everyone.
so much. Thank you.
Great, great, give me that.
All right.